Welcome to PEAKPro for case management agencies. It may take you 30 minutes to complete this training. Click Next to get started. The objective of this training is to clarify the workings of PEAKPro and how case management agencies can utilize the system. After completing this training, you will have the ability to explain the purpose of PEAKPro, understand what you will be able to do and see in PEAKPro, and know how to request access to PEAKPro and submit help desk tickets for PEAKPro. PEAK is an acronym that represents Program Eligibility and Application Kit. It refers to a set of guidelines and documents that outline the eligibility criteria and application process for a particular program or service. PEAK typically includes information on the required qualifications, documentation, and deadlines for submitting an application. It serves as a comprehensive resource for individuals or organizations seeking assistance or benefits from a program. PEAK is available online 24 hours a day, 7 days a week. This means that individuals or organizations can access the Program Eligibility and Application Kit at any time that is convenient for them. They can review the requirements, gather the necessary documents, and submit their application online without having to worry about office hours or wait times. This makes the application process more accessible and convenient for applicants and helps to streamline the overall program administration. Just a note, members can access their account on PEAK directly by typing http://jos.co.gov PEAK in their browser. PEAK provides members with convenient access to view their account information or view correspondence. Members can log into their account at any time to view important information such as their Health First Colorado buy-in premiums and payment history. They can also complete and submit their renewals and upload any necessary documents. In addition, members can receive text or email alerts regarding their account and view any necessary verifications that may be needed. They can also report any changes to their case, such as a change of address, and view or print their medical ID cards. PEAKPro is a powerful tool that facilitates the sharing of information and the automation of processes that were previously manual and paper-based. This means that the eligibility sites and long-term services and supports, LTSS, case management agencies, can now exchange important information. The information that is shared includes eligibility information, as well as level of care processing information. This helps to ensure that everyone involved in the process has access to the most up-to-date and accurate information, which can help to improve the quality of care that is provided to individuals. In addition, PEAKPro also allows for the sharing of referrals from county DHS and CBMS users, as well as individual PEAK users. This means that agencies and individuals can refer clients to other service providers and programs with ease, which can help to ensure that individuals receive the support that they need in a timely and efficient manner. Overall, PEAKPro is a valuable tool that helps to streamline the process of accessing and delivering long-term services and supports, ultimately improving outcomes for individuals and families. The eligibility and level of care, LOC status, is communicated electronically through these systems. The Care and Case Management System has been updated to eliminate the need for case managers to send the case management agency an eligibility information sharing form and certification pages to the county. The process has been streamlined, and the county no longer needs to send the form back to the case management agencies. The long-term care Medicaid systems rely on PEAKPro to facilitate communication and information transmission between the CCM and CBMS systems. PEAKPro acts as an intermediary interface, ensuring seamless integration between the two systems. The Colorado Benefits Management System is the source system for eligibility determinations and status. It receives LOC certification information from CCM via PEAKPro and communicates eligibility information and status with Interchange and PEAKPro. This ensures that all systems are working together seamlessly to provide the best possible care for Medicaid recipients. Interchange plays a crucial role in the system, receiving eligibility span information from CBMS and communicating eligibility status back to CCM and Bridge. Interchange also receives a waiver from CCM to create a benefit plan for the member. The Bridge system receives updated eligibility, goals, and service planning approval for prior authorizations, ensuring that all information is up to date and accurate. In PEAKPro, case managers are able to retrieve level of care assessment referrals from members and county DHS workers via CBMS. They also have the ability to view the current processing status of the LTC LOC certification that they entered in CCM and was sent to PEAKPro CBMS for processing. Additionally, they have the ability to search for any member that is known to CBMS and retrieve current eligibility data.
Expectations. There is now automated communication of the LOC certifications to county eligibility sites. The LTSS certification pages, CCM printout, or HCPF PDF, should not be used for this purpose unless explicitly directed to by the department. Example, communication that the system interface is not functioning. You should be able to receive referrals for LTSS programs as of November 1. Verify financial eligibility denials for initial applicants. View the processing status of the LTC LOC certification. View member financial eligibility and financial information.
For those who need access to PEAKPro, the standard provisioning process will be followed. Complete a HCPF third-party access request form and send it to HCPF OCL System Applications Estate.co, US for processing. The time frame for this step is 2 weeks. Communication regarding approval of access to HCPF will be sent with an org ID and passcode. To self-register, please visit PEAKPro and create an account. Then request a new user and enter the org ID and passcode. HCPF security will need to approve your request. This process takes 24 to 72 hours. Please note that there may be delays if you already have a Peak account associated with the same email address, or if you do not complete the self-registration process. You can find the guideline document in the resource link in the top right corner of the screen. Let's log into PEAKPro and navigate the screens and options.
When you first launch PEAKPro, this sign-in screen will display. You do not need to create an account, as you should have done that already before logging in. So just click the Sign In button. In addition to your personal password, Ping ID adds another level of security known as multi-factor authentication. PEAKPro will ask you to enter a 6-digit code, randomly generated by Ping ID on your phone. You will be required to enter a 6-digit code anytime you log in to a new device and every 30 days on devices you've already authenticated. If you do not log in once every 60 days, your account will be deactivated, but you will receive reminder emails before this happens. The options in PEAKPro you will be able to access is the CM inbox, CBMS eligibility check, LTC LOC certification process status, and reports. The inbox is the screen you are viewing now. You can perform a search by status, dates, first and last name, social security number, case number, source, and assignee. This is the assessment referral box. Let's talk about the columns first. Submit date. This is the date on which the referral was submitted. Tracking number. This number is assigned to the referral when it is received by PEAKPro. Clicking on the hyperlink will take you to the PDF of the referral. Status. This column shows the current status of the referral in the inbox. The CMA user is responsible for pulling referrals from PEAKPro and changing their status. The status can be changed to pending, complete, withdrawn, or duplicate from the drop-down option in the assignee column. Name. This column displays the name of the member for whom the referral is made. SSN. This column displays the social security number of the member. CBMS case number. This column displays the CBMS case number of the member. Source. This column displays the source from which the referral was received. It can be either PEAK, meaning a member referred themselves through PEAK, or CBMS, meaning the county DHS referred the member. Assignee. This column displays the name of the person to whom the referral is assigned. The CMA can assign the referral to another user within the assigned agency by selecting Update Assignee from the drop-down option in the Assignee column header. Transfer drop-down option from the Assignee column header if the referral needs to be transferred to another agency. Example, referral was sent to Developmental Pathways, but Rocky Mountain Human Services is going to work the referral. The system defaults to show all cases when there is no search criteria present. So let's do a new search. We will enter the last name and social security number, then click the search button. If you click the tracking number, it will download the member's application. You can view the eligibility of the member by clicking the blue linked name. A new tab displays. Each member will have different options in the PEAK eligibility check. It just depends on their application status. Client information displays the date of birth, social security number, the state ID and case ID, as well as the application date. You will also see the redetermination date if the member has had an open case for at least a year. The contact information provides you with the member's address, both home and mailing, the county they reside in, home and cell phone numbers, and an email address. Click CBMS Case Assigned User Information. This screen displays the assignee and provides the phone number, county office, and address of the assignee. Go to the top of the screen and close the tab. If you need to look up your client's case, you will use the eligibility check screen. If they have been on benefits before, you should be able to find them in this system. Click the Eligibility Check tab in the top banner. You can search by name, social security number, state ID, client ID, and date of birth. You need to search on at least 2 of these options. For this practice, you will search on the name and social security number. We will enter the last name and social security number, then click the search button. The member's name is a blue hyperlink that you can click on it for more eligibility information. Let's do that. As you can see, students' information is the same as the first screen we reviewed. We are going to close the tab at the top of the screen. Let's take a look at the LTC LOC screen. Click on the LTC LOC Certification Processing Status tab. The LTC LOC certification search options are much of the same as the inbox and eligibility screens. There are exceptions, though. You can search on the confirmation number by record type, status, and reason. Click the drop-down arrow for record type. These are the record types you have to choose from. LOC, determination. This is set whenever the record includes a LOC determination. This record can also include an address change. Nursing facility. This is set whenever the record includes updated nursing facility info and no new or updated LOC determination. This record can also include an address change. Address change. This is set whenever the record includes an address change and no new or updated LOC determination or nursing facility information. Click the drop-down arrow in the status box. For status, both processed and not processed mean the certification was received. Processed means no worker intervention is needed on that certification. Not processed means CBMS user intervention is needed either by reviewing and manually entering the LOC cert in CBMS, and/or the member has to apply before the cert can be entered. Click on the drop-down arrow in the reason box. When the status of a case in CBMS is not processed, a reason will be displayed to explain why the file could not be processed. The reason could be one of the following: unknown to CBMS. If the member is not known to CBMS, the record cannot post. The record will be sent to the PEAK inbox for the CBMS user to manually data enter. Member will need to submit an application for medical assistance. Known to CBMS, not active or pending, FF. The member is known to CBMS, but is not active or pending for a medical assistance. The record cannot post. The record will be sent to the PEAK inbox for the CBMS user to manually data enter. Member will need to submit an application for medical assistance. Requires manual review. This is set when an address change is received. CBMS user will need to review the address change and enter manually. System exception, set for any record submitted, but the record could not be posted due to a system issue. Example: LOC record received overlaps with another LOC record. This is a view of a LTC LOC certification search results. Only certifications that were received by PEAKPro or CBMS will be listed here. If a certification is not listed here, that means it was not received by PEAKPro or CBMS. Let's look at the items we did not review in the previous PEAK eligibility screen. We will start with
Click
eligibility
the arrow next to
information.
eligibility information.
This section displays type, primary or secondary, aid code. Example: HCBS, PACE, WA, WD, etc. Status. Example: pass, passing of aid code. Begin date, start of that aid code. End date will be displayed if that aid code is ending or ended. If open, then they are active on that aid code. Reason. Example: no longer employed. Next, we will look at eligibility details. The eligibility details section provide information about current medspan begin, date, when the medspan began, current medspan end, date when the medspan ends. If blank, then medspan is still active, open. Disability diary date will display if member has a diary date, will be blank if no diary date to display. SSI eligible, member is SSI eligible. Limited to EMS RHCS, member has limited benefits. Active POI, member has an active POI. Home care allowance displays a dollar amount. MF patient payment displays a dollar amount. Now we will look at LTC level of care information. This section shows you the level of care the member is receiving. Level of care decision, example, approved, denied, pending. Level of care type, example, HCBS, PACE, nursing facility, hospital, undetermined. Level of care start date. Level of care end date. Level of care confirmation number. Let's look at LTC institution information. In this section, you will see the following: institution information, institution name, national provider number, admit date, discharge date. Now we will look at missing items or verification information. This section displays missing verification, type of verification the county is requesting. Due date county is requesting the verification by. There is other information that could appear on this screen. Here are the three we did not talk about. Income information, income type for member searched. Frequency, how often the income is received. Amount, total. Gross countable monthly income for member searched. Other insurance information, other insurance company, provider name, policy. Aga our group. Va Medicare information. Medicare X. Part A, Part B. Buy-in status. X. Free. Part A, paid for by state. Buy-in. Coverage, begin, date. Now let's take a look at Reports. Click the Reports tab. The case management agencies will now have access to new reports, which will provide them with valuable information. This first report is the total number of assessment referrals, which will provide a list of the total assessment referrals per county. This report will give an overview of the number of referrals received by each case management agency within the entered date range. Let's look at the assessment referral details by county. The assessment referral details, which will provide a more detailed list of each referral within each county. This report will include information such as the date the assessment referral was received, the current status of the referral, and the number of days in each status. This report will also provide information on the number of days from a new referral to a complete status, a pending status, a withdrawn status, or a duplicate status. These reports will be beneficial for the case management agencies to track the assessment referrals they receive and their status. Now that you have had an opportunity to view the system, there are still some information you will need to know before you get started in this new version of PEAKPro. There are 4 other reports that you will see, but will not have access to unless approved during the access request process. Active user. This report provides a list of active users in PEAKPro deactivated users. This report provides a list of all the deactivated users, organization structure. This report provides details about access levels, agency names, and PEAKPro organization subtypes, agency administrators. This report provides a list of all agency administrators, including their access levels, agency name, and PEAKPro organization subtypes.
Here is some guidance for the inbox. Your CMA's designated contact for PEAKPro will receive a weekly email outlining the total number of assessment referrals received through the platform for the previous week. These referrals will be categorized as either new or pending. It is possible that not all case managers will require access to view the inbox. This will vary depending on the organizational structure of your agency. To view the eligibility check page for a particular member, click on their name in the inbox. When you receive an email referral, it could mean one of 2 things. A member has indicated the need for LTSS in PEAK, or a CBMS user received information from the member, indicating the need for LTSS and has pended the CBMS case for LOC determination. Remember, after you receive a referral, you can check the eligibility status in the Eligibility Check tab. Case management agencies must process referrals according to current timelines. Case management agencies will be able to change the current status of referrals from new to pending, complete, withdrawn, or duplicate. The CMA should use the status drop-down Complete to indicate they have received the referral, and then proceed to conduct all intake, enrollment tracking, and processes in the CCM as they currently do. Changing the status will send an alert to the member's case in CBMS that the LOC assessment determination is in progress. Case management agencies should transfer referrals to other agencies when or if the referral has been inappropriately assigned to their agency. For example, the member no longer lives in the agency's direct service area. There are visible differences between a referral from CBMS and PEAK user. Here is how the LTC LOC certification process works. The case manager completes a level of care assessment in CCM. Information from CCM goes to PEAKPro, then to CBMS. CBMS updates the LOC. Not all level of care LOC assessments will auto-update in CBMS. If a LOC assessment was completed in the CCM and the county is reporting they have not received the LOC record in CBMS, follow these steps. Log into PEAKPro and go to the LTC LOC certification processing page. Perform a search for the LOC record. If you are unable to locate the LOC record in PEAKPro, please report the potential CCM transmission issue to the CCM Support Center to inquire on why the LOC record was not included in the file. If you can locate the LOC in PEAKPro, provide the county with the member demographic information, file date, and confirmation number for the LOC record. This information will be helpful for the county for CBMS research and help desk ticket purposes. CMAs can locate the LOC confirmation number in the CCM by going to the LOC assessment URL. If a case manager has an unusual circumstance with a member that requires a paper form of the level of care assessment to be submitted, please refer to the Long-Term Care Certification Form Job Aid to utilize this process. What can case management agency organization contacts help with? They can help you with creating PEAKPro accounts for new users, including providing training and help resources, requesting access, setting up Ping ID, signing as a supervisor on all third-party forms and submitting to OCL, helping with the self-registration process. If you need to reactivate your PEAKPro account because you had not logged in after 60 days, a separate third-party form will need to be signed and submitted to OCL. If you are having issues with the PEAKPro application that is not technical, contact Peak Technical Support to create a help desk ticket, HDT, after troubleshooting by your user and organization contact. Now you are familiar with the items the CM organization can help you with. Here are some key takeaways from this training. PEAKPro launched on 3/1/2024 with access to the eligibility check and LOC certification processing status. Then on 11/1/2024, the referral inbox and reports will launch. What you need to know about PEAKPro for CMAs. Create your account if you haven't already done that. If you don't create your account and try to log in, the system will tell you it can't find your username. Take some time to explore the options that you learned in this training. You can check the member's eligibility at any time or when prompted by the CCM. The PEAKPro system is ready for you to use. This training is not the live production database. The screens may differ once you are logged into production. Thank you for reviewing this training. You can now close your browser.